everybody. This is Kathy Ann and Jennifer, and this is our podcast, Deception in Healthcare in America, with Kathy Ann and Jennifer. And today we are going to talk about kidney stones because my husband just had a kidney stone and we just have the weirdest story. So he went to the emergency room because he felt this horrible pain in his back and his, abdomen. And he was actually on a business trip and he was on the flight home and he had to ask for medication on the flight. And so I picked him up and he was in horrible pain. And the next day, about 3 o'clock in the morning, we went to the emergency room because we thought his appendix was going to burst. But it turns out he had a kidney stone. And the ER, the doctor called it pretty quick. Before they even did the CT scan, he was like, I think that you have a kidney stone. And I just kind of like, okay, the scan showed that the kidney stone had just entered the tube in his lower abdomen and was causing excruciating pain. So they hooked him up to an IV and they gave him pain meds. And then they gave him a packet to look over, an aftercare packet. And then they gave him a referral to a urologist. I thought this was pretty interesting. And Jennifer, you can add to this because you know so much. So there's a part of the guidelines about eating and drinking. And one of them says, drink a lot of water. Okay, that's fine. My husband drinks tons of water. And then it says to eat more fruits and vegetables. Okay, that's fine. And then it says limit how much animal protein you eat, including red meat, fish, poultry, and eggs. So I'm not a dietitian or nutritionist, but I do follow an anti-inflammatory low-carb diet. And limiting eggs and like fish, I would never do that. But it says to limit that. It says to avoid spinach, rhubarb, sweet potatoes, and nuts. My husband doesn't eat any of those except for nuts. But what I see here is that they just asked you to eliminate some of the most healthiest foods you can eat. So I decided to look up what causes kidney stones. And there's so many answers out there. And actually doctors are still really unsure what truly causes kidney stones. But soda is top on the list, and alcohol. Not one time is soda or alcohol mentioned in foods or beverages to give up. And I just found that strange because they asked you to give up eggs and spinach, but they didn't ask you to give up Coke. Does that make sense? So I found that very interesting.
Well, okay, so what I can tell you is, first of all, the water, so your kidneys filter everything out of your body, right? So in other words, his kidneys were filtering out. So kidney stones are caused by too much of something. So it could be too much sodium, it could be too much potassium, it could be too much whatever. And if they test those kidney stones, they can tell him, hey, you need to whatever with this, or you might even have a deficiency. You need more of this, and your body made a kidney stone, and you're trying to pass it. And yes, it's incredibly painful. I had 3 little kidney stones back in 2009. And I was in the hospital. Like, it was bad. I've had 2 babies. Like, you've had 3. I'm telling you, it's like labor pains. It's horrible. And, men are babies anyway, so I can only imagine it's probably like 4 times worse for him. But if he's like my husband and my son, they're ridiculous. But it is that painful to take you to the emergency room. Like, you think, like, I don't know, it's bad. And the reason the pain in the back is because that's the kidneys. Your kidneys are back here. You touch your kidneys, touch back there. And yeah, that's pretty painful. And then in the abdomen, I'm not really sure why the pain radiates through that direction, but it's bad. Anyway, but the reason, going back to the guidelines they gave him, the water, I understand the water. You're flushing. It helps you detox your kidneys, helps flush that through. You want to get those kidney stones and push them through. And every time you pee, you want to like try to catch them. And they're tiny. They're so little. And it's like, but to have to pass through, the urethra and stuff, that's what's so painful. But as far as like where they're telling him about the sweet potatoes and all those foods right there, those are high in potassium. And so I know this because I know someone really well that sees a nephrologist. I actually know two people that do. And so I understand the whole renal diet thing. And so when you come in there with kidney stones, they're just going to basically talk to you as a person with kidney issues. They don't know what's going on. Once again, you went in the ER. They're trying to treat the imminent threat, the pain, the kidney stone. They found it. They did x-rays or whatever they did with him to find his kidney stones, probably, right?
Yeah, they did a CT scan.
Right. Okay, so they had to find them. And so now they know what it is. So now they're just looking at, kidney. So they don't know if what kidney issues he's got. You'd be shocked how many people in the United States just have kidney issues or having chronic kidney disease. They may be in stage 1 or 2, which, as absurd as that is, like, a lot of people are dealing with this because people are not detoxing, they're not eating properly. Like, we've got 20 and 30-year-olds already in stage 1, and this goes on for 10 years, and they go in stage 2 for another 10. And by the time they're 40, now their blood pressure's screaming, and they're having, kidney stones, or again, like several reoccurrences, and then they go back to the kidney. It's like, you're beating your kidneys up with your lifestyle, what you're doing, what you're eating and drinking. But anyways, so that's why they say the sweet potatoes and stuff. People that are in chronic kidney disease or on dialysis or just having renal failure, like a renal diet, potassium is hard on your kidneys, and excessive protein. So it's like, I don't know why he's not in kidney disease or anything. So I guess it would just kind of lighten the load if he just maybe, because, and then especially men, just in general, like I am a nutritionist, so I see people's diets, and men tend to eat 3 times the amount of protein than a woman does. Like, they're just, I don't know. It's just the way, I don't know if it's the way they're wired. I don't know, but men, just even throughout history, men want meat and potatoes. You've heard that whole whatever spill about, men, meat and potatoes, and a woman will turn to a salad and maybe throw, 3 or 4 ounces. No man is gonna. Have you ever seen a man sit down and eat a salad and have 3 ounces of some type of meat on there? I don't think so. Like, yeah, they're gonna have a steak in a salad or whatever, steak and potato in a salad. But that's what their guidelines are. But once again, it's kind of like the whole nutrition guidelines of the government. They tell you to eat things that, well, just basically make no sense. It just keeps you on this rat wheel of going round and round. But if he were to go home and eat all the water and fiber and eat his meat, I mean, he's going to pass those kidney stones and he's going to be fine. It's not going to make anything any better. It's not going to take his pain away. They just treated him as if he had like renal issues, like he's got kidney disease. And then they'll just let a nephrologist or somebody look over him, or a urologist, either one, and be like, okay, yeah, you're good. Sign off on your bill of health. Like, you just have a deficiency in this, or you have excess of magnesium or potassium in your bloodstream. Like, there's an imbalance in a mineral somewhere. That's usually what it is. And then they have to test those kidney stones because they can look at them and tell you, like, oh my God, you have way too much magnesium, or you have way too much this. And then you can go in and address your diet and work with that urologist. That's all the kidney stones are. Like, I've never had them again. Thank God. I don't know what mine was. I ended up catching mine, and then I was like, you know what? I didn't even end up going to the doctor. I passed them, and I thought I had been in hell. And I'll be honest, like, by the time I felt better, I put it behind me. And I think I kept those little kidney stones, I don't know how long, and then threw them away, But the smart thing to do would have been to go ahead, I retrieved them. It would have been to go take them to the doctor and find out. But I've never had them again, so he may never have them again in his life. But that's what their little nutrition protocol or guidelines are for. They went a little on the excessive side with the protein and all the other stuff,
Yes.
Let the urologist take care of that.
Yeah. So at the ER, he was given a set of instructions and a referral. So they gave him a strainer that he had to pee in to catch his kidney stone, and then a cup to put what he catches. And then he was supposed to call the urologist if he hadn't passed it in 1 week. And then he was supposed to take the cup to the urologist so they could analyze the kidney stone.
Right.
So just so we all know, my husband still has not passed it. So he called the urologist. Because he was concerned because he hasn't passed it, but he did catch a few little things in the cup. Okay. So he makes the appointment and he sees the urologist. And I actually went with him, but it was T-Mobile Tuesday and they were giving away free football bags. So I left the appointment to go pick up the T-Mobile bag. And he said he wished I would have been there. So we thought it was going to be straightforward. We thought, okay, he has a kidney stone. He hasn't passed it. He has this cup. It's very straightforward. So I didn't think I needed to be in the room. But apparently, all hell breaks loose when he goes in the room with the doctor because he got an x ray like 2 days before because they required it for his doctor appointment. And it showed that there was no kidney stone. Okay. And so I was like, oh, you must have passed it. And he swears he never passed it. He's been straining his pee. Uh, okay. So the doctor comes in and the doctor had seen the x ray. And this is me recounting what he says. He says, the doctor goes, you don't have a kidney stone. Why are you even here? And my husband looks at him and he's like, well, because I have a kidney stone and I haven't passed it. And he goes, no, you don't. And my husband's like, well, yes, I do. And my husband proceeds to tell him that he went to the emergency room and they saw the kidney stone and that he was referred to him by the emergency room. And the doctor gets really confused and gets up and leaves the room. So now my husband's sitting there like, what the hell is going on? I filled out 4 pages of paperwork telling you what's wrong with me and how I got here, and you don't know anything. The doctor ends up coming back and he goes, okay, I see that you have a kidney stone. And so my husband explains to him that, what the ER says, and tries to give him the cup, the collection cup that the emergency room doctor told him to give to the doctor. And the urologist goes, dude, I'm not touching that. My husband says, I didn't ask you to touch it, but I was told that I'm supposed to bring this so you could analyze what's inside. And the guy's like, oh, no, we're not doing that. And my husband's just shocked. So what ends up happening is he's pretty unprofessional, in my husband's opinion. My husband says he was very unimpressed. And the doctor says, I'll see you in 2 weeks. And if in 2 weeks you haven't passed the stone, then I'll order a CT scan. So my husband goes, why am I going to go back and see him and pay for another doctor visit for him just to get another CT scan? He goes, I'm going to just cancel my appointment and then just call in 2 weeks and say I'm supposed to get a CT scan if I haven't passed it. But what the hell is up with this doctor? Like, he goes in there and like, why are you even here? You don't have a kidney stone. It's like, dude, did you not like read the paperwork? Like, do you think my husband just goes to urologist because for fun? So
I would 100% say he didn't read the right file, and he had to excuse himself to go retrieve his file. He had the wrong file and brought it, and then looked at it and said, "Oh shit, it happened." And then like, okay, instead of coming there and telling you guys, okay, my mistake, whatever, he dropped the ball. Sounds like he read someone else's file and he's trying to figure out. He didn't look at anything. He just picked it up. Like maybe the wrong one was the front or the back, or I don't know what their little. I don't know how they run their office, but.
So they think that
it happened with my daughter-in-law.
I remember that. That was weird. So it happened.
Yeah.
So
I do it, and the lady apologized and said, "I'm sorry. That's really common. We happen to do that. I'm really sorry." They told them they were having a boy when they were having a girl. This was blood work. They read someone else's blood work to her, and then 2 or 3 days later, I mean, this went on for maybe 4 days. I don't know. We had to have another ultrasound in between there, and the lady's telling us, "No, you don't have a boy." Like she kept saying, "Do you see that little area right there? We call that a female. That's female organs, not male." So all I'm saying is they're human and they make mistakes and they move around too quick. But I would 1,000% say that he picked up the wrong file and that's what happened. And that conversation could have went completely different, and your husband wouldn't have seen him any less, like as less of a person.
Yeah.
You know what I mean? Like,
well, now
just be honest.
Yeah, but now my husband doesn't trust him because the guy's like, dude, why are you even here? Because I think it's fun to go through the urologist. Right? I mean,
once someone deceives you, you're not really listening to too much else they say. He could come in and be completely 1,000% with him after that, but like your husband doesn't trust him now. So,
right.
I mean, he would be totally with rights, and it would be understandable if he chose another urologist or just went somewhere else and try to figure this out with a regular physician or something. I don't know, but I mean, I'm with him on that. Like, just be honest. We're all human beings. Nobody's perfect. So when you drop the ball, you tell someone, hey, look, I apologize. This shouldn't have even happened. This won't happen again. I picked up the wrong file. Like, I'm just, I need to get myself, my head's not there, and my head needs to be there. I apologize. You deserve better than that, and let's start over.
Right. Because we think
That's
that exactly, just admit you made the mistake instead of going like, dude, and like, I'm not touching your kidney stone thing. It's just like, but the ER doctor told him to bring it because they're supposed to analyze, what's in there. And he didn't have the big stone in there because he didn't pass it, but he had these little flakes in there. And we were told to bring it. And the urologist is like, what are you doing? Like, he's like completely grossed out. Like, why are you even a urologist if you're going to get grossed out by what somebody pees out? You know what I'm saying? It was just, so I wasn't there, but my husband would prefer not to see this person again. And
yeah, and I would agree with him. He's totally that's totally reasonable. More than.
so he still hasn't passed the kidney.
He lied to him and looked at the wrong file, and then went back and said, oh, that's why he left the room. He went and he was like, am I looking at, oh shit, he has a kidney stone. Then you come back in there, and then you're so offended by his little flakes or little pieces of stone that he brought. So that's like, yeah, that's too much.
Yeah.
That's too much.
So we're still waiting for him to pass the stone, and like, the doctor's hard to believe now, and the doctor thinks it's lodged in his bladder. It's stuck in there. But again,
they're gonna remove it. I mean, they'll find a way to remove it. You can't leave it in there. But
so that's where we're at now. But you know what? I've heard of kidney stones. I've heard of people having them, and I never did the research. But this is actually pretty common. So I'm going to give you some statistics. So 1 in 10 people will develop a kidney stone at some point in their life, and they're more common in men at a ratio of 3 to 1. And medical science is really unsure of why that is. And you had mentioned men tend to eat more meat. My husband really doesn't eat that much meat, but I was reading an article in a medical journal that said that men's hormones, the testosterone and the androgens, may play a role in developing kidney stones, and women don't have a lot of testosterone and androgens. And if it's hormonal, then that would explain why some stuff. Also, back in the 70s, 1 in 25 people would develop a kidney stone. Today, about 1 in 10. So it's jumped quite a bit.
And what's changed?
What's changed?
What's changed in 25 years? You tell me.
We now have pesticides in all our fruits and vegetables, unless you get organic. So everything's laced with pesticides. It's this ultra processed foods, this fake food that makes up the bulk of our diet. So yeah, I would say ultra processed foods and chemicals.
Food. That's it. Your processed food, your packaging, what they've done to our meats, lunch meats, like the convenience of everything. It's the food supply. It's like with everything else.
Yes.
That's why it's jumped. That's not a coincidence.
No, I agree with you 100%. Around the 60s and 70s is when we started changing the way we eat. So yes.
Yes.
And let's see, some of them are super small, like a grain of sand. And get this, they can be larger than a golf ball.
Ooh. Wow. Mine looked like, have you ever seen a big piece of like sea salt? Like a really like a large piece of sea salt? Like what would be a large piece of salt? That's what I had, like of those. Okay. They were kind of in that range, and so I can't imagine anything Yeah. And I don't know anybody else in my family, so as common as you're saying they are, like no one in my family. One of my husband's brothers, he actually gets them like every couple years. Like he'll just come in there and just fall to his knees and start hollering, and man has no other health issues, but he just starts hollering. He's been different places and been at the mercy of whoever was around him at work or whatever. I know he's had him at least 3 or 4 times now, so that's pretty interesting. He'll kind of be in conversation with my husband. He's like, yeah, I had to go to the hospital. I had him again or whatever. And it's like, my goodness, I would definitely be trying to find out what I was in excess of or deficient of, because I'm telling you, ask your husband. He never wants to see him ever again. They're horrible. They are hell. They're awful.
Well, I mean, along those same lines, nobody in my family has ever had them, and nobody in his family has ever had them. He's the first.
So same with like my husband. He's the only one in my family. My parents have never had one. My brothers, yeah, me. I just kind of like my type 1 diabetes. I'm just the weirdo over here. I'm genetically, dysfunctional over here.
Well, so there's 4 kinds. I actually saw
Anyway,
somewhere where it said 6 kinds, but we'll just say 4 kinds. It was really hard to do the research because it was very complex. But you have the most common, the calcium stones, and then there's uric acid stones, and then there's struvite stones, which those are associated with urinary tract infections, and then there's cystine stones, which is caused by a rare inherited disease. Your risk factors include not drinking enough fluids. Don't drink sodas because that's a cause.
They dehydrate you. Of course. They dehydrate you.
Also, if you have a family history, a blockage in your urinary tract, if you eat foods high in sodium and sugar, which sodas are high in sugar, if you take certain medications like diuretics, antacids, it can attribute to your kidney stones. And, oh, you want to hear the symptoms? So this is kind of interesting because right before my husband's kidney stone showed up, he peed a orange colored pee and he thought it was really funny. Because he drank, the Martinelli's apple shine. I think my mom used to buy it in those bottles. It was the carbonated apple juice.
Mm-hmm.
Okay. So they
Carbonated
came out
apple
with
juice, yeah.
Yeah. They came out with a mango flavor and we love Martinelli's. So we bought the mango flavor carbonated apple juice. And
it is
after he drank it, his pee was bright orange, like an orange he'd never seen. And he thought it was hilarious. And he told the kids, if you drink one, your pee's going to be orange. And they all drank one and nobody had orange pee. So he thought that the pee was actually a precursor to the kidney stone because when he was reading other people's experiences, they also had orange pee as well. And so he thought, oh, maybe it wasn't the Martinelli's mango apple cider. Maybe it was the precursor.
Yeah, but also a dark colored urine sign of dehydration. So it would be kind of hard to know,
Yeah, that's true. So some of the symptoms are nausea and vomiting, which he did both. Actually, he was puking the day before I took him to the ER, bloody pee, painful, not being able to use the bathroom, or feeling the urge to use it a lot. Fevers and chills. He did have the chills, but he didn't have a fever. And
you feel like you need to keep going to the toilet and there's nothing. There's like drips and it's like, oh my God. And then you think you have a UTI.
Oh.
That's what you first think. You're like, oh, there's something. I'd be like, I have a urinary tract infection. I don't know. I've never had one of those either. You're like Googling, you're looking.
Yeah.
At the time, Google was pretty new. That's what I kind of thought. And I thought, you got to be kidding. This is terrible. And so I'm calling my mom, calling different people like, oh, I've had those. You'll be fine. Go to the emergency room and they'll give you an antibiotic and this and this. And you'll be fine. And I get there and, they're like, oh, no. Like they did the CT scan or whatever. And they're like, oh, you have kidney stones. And I'm like, well, what is that? So.
Yeah. And then cloudy or foul smelling pee. But yeah, you're right. Because I did this before I took him to the emergency room. I was like, okay, throwing up, your back hurts, your abdomen hurts. And it was coming up like appendicitis. And they were like, oh, we just got to go anyways. But yeah, I mean, a lot of this could be almost anything.
As I was reading, I was kind of jumping the gun in my brain, and I thought, oh, he had appendicitis. You got to be kidding. And then I kept reading, and then you said kidney stones, and then I went, oh, yeah, those hurt like worse than probably appendicitis. They're terrible.
But also, and I found this to be very interesting. Kidney stones is one of the oldest diseases known to medicine, but they're still unsure of the mechanisms of the stone formation and development. They're still not really sure why it forms in some people and not others. And again, that goes back to like maybe hormonal or just something going on that they're just not quite sure about. I eat tons
like I said,
of
it's
meat.
excess in minerals, and then like things are just not working properly. And then you take, like, we just had a whole conversation about diet, all the things that they think triggers or cause it. Or like, let's say a medicine, you take a medicine that depletes your body of potassium or magnesium. It could be some pill or medicine that somebody has to take. It kind
You
of
know what
all
it made
goes
me
back
think?
to you're having to put in your.
It made me think of like how an oyster forms a pearl. You're just like, something's happening and you're like forming this stone, the same way an oyster forms a pearl. It keeps just putting a layer and a layer and a layer on there until you have this big pearl. When he passes that
Yep.
stone, I'll put it on a necklace and he can wear his little pearl necklace.
Let's
But
not.
hilarious.
Let's.
But yes, one of the things I saw, which was interesting, is it said to eat a more alkaline diet. I won this water bottle that turns your water alkaline, and he just recently started using it, and it's like, okay, yeah, alkaline water. So
Which
I don't know.
I don't know. They've done like the third party testing on some of those, and apparently we're just getting like basically, if you just stick with osmosis, reverse osmosis water, I think that's pretty much what it is, and they're throwing on there that you're getting this certain pH balanced water. But I think like the last time I looked at that, it's been like 2 years ago. But they took like all these waters and tested them, and like they would be no different than the I don't know, the reverse osmosis, Sam's or Costco water. So I'm not.
Mm-hmm.
I don't know how solid that is. You could probably look into those studies. I do alkaline water because a body that has that's more alkaline than acidic, that's supposed to like be acidity is supposed to be a breeding ground for diseases, cancer, and all these things. So that's why the alkaline, you want your body like pH balanced. So I don't know. I still haven't figured out the whole water thing. I drink the alkaline too. So me and my daughter drink it. I just actually like the taste of the particular brand we buy from Sam's. They come in these huge, it's a liter of water. And I try to get those down a day, and I've done pretty good. But if people just hydrate. Just don't drink
Keep
tap
hydrating.
water. And drink tap water. Just don't drink tap water.
Again, I'm not a doctor. We just experienced this in the last couple weeks, and it just made for an interesting story because it's something we're going through now, with having to go to the emergency room, being berated by the urologist and still not passing it, and analyzing his diet. And that's kidney stones for you. And the thing to remember is about 1 in 10 people will develop kidney stones at some point in their life. And over 500,000 people go to the emergency room due to kidney stones. More men than women develop kidney stones. It's at about a 3-to-1 ratio. And if you do develop a kidney stone, the doctor you want to see is a urologist. And lastly, if you develop a kidney stone, take a look at your diet and see what's going on there. And if you have any questions, you can consult a doctor. And we hope that you enjoyed our podcast and learned something and were entertained. And we'll talk to you next time. Bye-bye.